We acknowledge the traditional custodians of the country where this video is filmed and their connections to land, sea and community. We pay our respects to their elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples. Aboriginal and Torres Strait Islander peoples should be aware that this video may contain the images and voices of people who have passed away.
Create a welcoming environment at your clinic with a symbol to show that your space is inclusive, such as displaying the Aboriginal or Torres Strait Islander flags. Undertake workplace cultural awareness training and promote that your clinic or health service has done so on your website or other locations. Individual staff members and practitioners could also display their certificate of attendance in their offices or consulting rooms so that clients can see they are speaking with a person who will maintain their cultural safety. It's important to spend time yarning with your clients to build rapport and trust, as well as understand the barriers they may face to participating in cancer screening. Shame, fear and embarrassment about talking about cancer or fearing a lack of cultural sensitivity may be a barrier. Preface sensitive questions to allow your clients to prepare mentally and emotionally before responding. For example, you might say, "I need to ask you some sensitive questions about your health today. I need to ask these questions as part of our regular health checks to make sure that I can support you to stay deadly with your health." Observe body language and facial expressions that indicate the information has not been fully understood and rephrase comments or questions if needed. Avoid using jargon, rushing and asking too many questions all at once. Help clients to understand that their information is kept private and all conversations are confidential. Respect the cultural sensitivities around men's and women's business by asking clients whether they would prefer to see a male or female health worker. Cancer screening questions are part of the 715 health check for people aged 50 and over, for bowel, breast and well women's checks, and for women aged 25 and over for well women's checks. Cervical cancer rates in Aboriginal women could be as much as double the rates of those in non-Aboriginal women. Cervical cancer is preventable.
My name is Dr. Annapurna Nori. I'm one of the 2 public health medical officers at the Aboriginal Health Council of South Australia. By training, I'm a public health physician as well as a GP, and I've worked for many years, close to 20 years now, in Aboriginal health. So in regard to cervical cancer, again, this is an area where we do need to close the gap. So cervical cancer affects Aboriginal women at twice the rate that it does non-Aboriginal women. And on the flip side, Aboriginal women participate less in cervical cancer screening than non-Aboriginal women. Now, till 2017, the test that we used to do was called the PAP test, which was after the Greek man who invented the test many, many years ago. And both the PAP test and currently the new test, which is called the cervical screening test, both basically are looking at the virus which can cause cervical cancer, which is called the human papilloma virus. What the PAP test used to do was look for changes that the virus could cause in the body, whereas what the cervical cancer test does, which is what we're doing now, is looks for the virus itself. So the cervical cancer test is offered to women between the ages of 25 and 74, and it's done every 5 years.
When doing the well women's checks, your client now has the choice between self-collection or a speculum examination. Both are just as effective at preventing cervical cancer. Self-collection may be a way for your clients to overcome the many barriers they face when doing a screening test, such as shame, fear, embarrassment, pain or trauma from doing a speculum examination. To do a self-collection test, your patient uses a long-handled cotton bud to take their own sample in the privacy of an examination room or the clinic toilets. Once completed, they return the sample to the doctor or nurse. When filling in the forms, make sure that you include your client's Aboriginal and Torres Strait Islander status. Before you can offer self-collection to your clients, you need to make sure that you're set up for self-collection. To do that, you'll need to order resources and kits to have available for clients when they come to see you. To prepare your clinic to have self-collection available, visit the self-collection section of the SA Health website to find more information about ordering kits and resources. If your client chooses self-collection as their preferred test, make sure you talk to them about how to complete the test first before directing them to a private area. If they choose the speculum examination, make sure you talk through what will happen and that they can stop the test at any time.
Please also remember that all cervical screening test results are sent to the National Cancer Screening Register. Just the way when we do immunisations, we upload it to the Australian Immunisation Register. When we do cervical cancer screening, and the pathology labs do send those results on to the National Cancer Screening Register. And the register does some amazing stuff, and one of it is that they will send a woman reminders if they're overdue for the cervical cancer screening. So in order for that to happen, it's important that the woman's contact details are up to date. So apart from all the other reasons that you're told about why someone's contact details need to be up to date, this is another really important reason, because cancer prevention is really important for the health of all women, especially Aboriginal women.
For more information about the National Cervical Screening Program, visit ncsr.gov.au.